I'm Barney Giblon, and I'm a past chief of family medicine at the Scarborough General Hospital. And I've been asked to talk about my career as a family physician and my relationship to the Department of Family and Community Medicine at the University of Toronto. So I did graduate from University of Toronto. I did a one-year rotating internship at New Mount Sinai Hospital. That's what it was called then. That's in Toronto. And then I opened my family practice office in Scarborough. I practiced at the same location for my entire career. I joined the medical staff of the newly opened Scarborough General Hospital, the first hospital founded in Scarborough, and became the chief of family medicine in 1991. At that time, the University of Toronto Department of Family and Community Medicine underwent its first expansion from a moderate-sized department of downtown teaching hospitals to a much larger department with 4 community hospitals in Toronto's suburbs. And one of those was my hospital. I became a member of the Department of Family and Community Medicine executive and founded the hospital's family practice teaching unit. Since that first expansion, University of Toronto Department of Family and Community Medicine has spread to many areas in southern Ontario, and it might even spread to northern Ontario. Actually, some programs at the Faculty of Medicine are in northern Ontario. The physician's assistants, for example, is in northern Ontario. The amazing history of our department has not yet been written. It has now become the largest department in the Faculty of Medicine at University of Toronto, with the largest number of residents of any department. So from 2 little rooms in the upper floors of a downtown hospital, the department now occupies 2 full floors on in the largest building at the University of Toronto. And because of the consultant teaching requirements in community hospitals, the department consists of many types of specialties in addition to family physicians. And the practice of family medicine has changed as well, with patient care being considered by teams which include all of the healthcare professions. And healthcare is now patient-centered, a concept which has improved the results of medical practice. The Department of Family and Community Medicine at U of T has played a leadership role in all of these developments and improvements. The role of the community hospital has changed over the years, and my role as chief also evolved. I became the medical director of education and research, and the hospital expanded to become an important member of the community with links to residents and businesses in Scarborough. Subsequently, there were 2 other hospitals established in Scarborough, and now all 3 of these hospitals have merged to form the new Scarborough Health Network, with responsibilities for all of the health needs of our community. And our department locally and at the university has helped form these links with the community. In 1994, I served on the Department of Family and Community Medicine's 25th anniversary committee, and now we're celebrating our 50th. If you asked me about my favorite memory for me and my family, it would be the department celebration in 1999 when my wife Beverly and I endowed the DFCM Research Professorship in Research. My hope now is that with the help of advancement, we could attract sufficient funding to establish a chair in our department. I previously served as president of the Medical Alumni Association as well as the University of Toronto Alumni Association, and have worked closely with the university's advancement department to provide funding for not just medical students and programs, but for all of the other healthcare professions who provide care for our community. So the key words are healthcare education and providing that healthcare to the community. One of the important roles of University of Toronto's Department of Family and Community Medicine is to encourage family physicians to expand their knowledge and to engage in research in the community. Medical practice and knowledge are changing so quickly that we cannot foretell the future. But it is our responsibility to prepare future physicians for the ability to deal with all of these exciting changes that are about to come. I think we are prepared for this challenge. And of course, I wish for a wonderful and happy 50th anniversary for the most important department at the University of Toronto.